Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Our guest in studio today is returning to speak with us, Dr. Frank Ditz. He's a board-certified physician located in Rockledge, Florida, specializing in primary care and family medicine. Currently, his practice is located in the Suntree area. He's soon to be opening a state-of-the-art 8,500 square foot facility about a mile away in Melbourne, Florida. He's been practicing there in Rockledge, Florida for the past 12 years. And he's here today to talk with us about not only being a practitioner specializing in primary care and family medicine, but to speak specifically about some of the other areas of expertise that he's involved with. How are you doing today, Dr. Ditz?
Very good. Thank you. How are you?
Doing well. Yeah, well, you're a very busy man, but not as busy as you were before becoming a partner with SignatureMD Concierge Medicine. Could you talk a little bit about how being a member of SignatureMD Concierge Medicine has helped you practice in more than one specialty?
Oh, well, in family practice, and the best thing about family practice is that we practice in every specialty. Okay. So the entire patient from birth to death, from the birthing process to deliver babies, so my oldest patient's 104. We practice the whole spectrum, so that Signature helps me to do all that.
Now, is this something that's extremely expensive?
Concierge practice of medicine is actually not expensive whatsoever. If you think about the amount of money that people pay for their health insurance and their medical insurance, and then they find when they try to use it, they have no access. They can't get in. Mm-hmm. The doctors don't answer the phone. They're booked 3 months in advance. They find out really what they have, whereas in the concierge practice, to join SignatureMD is probably the equivalent of having a coffee latte at Starbucks every day. It's not much more than $100 a month for the ability to spend a lot more time to see their doctors, to have an hour and a half executive physical at least once a year, to have the ability to do specialized, comprehensive metabolic panels of clinical labs. And to really, have more time to know the doctors and the staff and have that personal one-on-one relationship with them.
Now, you're a family practitioner, but you're also a local there in the Florida area and a national lecturer for physicians, nurses, pharmacists, and others on various aspects of medicine, including, but not limited to, insomnia and hypertension.
In the past, I gave lectures for insomnia, osteoporosis, hypertension, disaster response teams, diabetes, all sorts of different things. And the traditional practice of medicine, you spend so much time, trying to take care of the patients in front of you. You don't have time to eat lunch or have dinner or see your families. So really, outside the practice of medicine, you don't really usually have a life or the ability to do such. In the Signature program, though, you do have the ability to take care of the patients to the best of your ability. You may not be able to take care of as many, but you can do a lot more quality for the ones you have in front of you. And that does open up the quality of life to do other things. In the practice of medicine, by taking care of one person, I can help save their life. As an instructor, I can help train other physicians and pharmacists and other healthcare providers and save, by that way, thousands of people's lives.
When you're lecturing, say at a learning institution or some other facility, do you talk to students about the possibilities of considering concierge medicine? Well,
actually, that's kind of amazing. I never thought about that. But with all the things that I've given lectures on in my lifetime, I've never actually given a lecture on the practice of concierge medicine.
Is it something that you think you might consider? It sounds like a huge benefit, especially to folks that are getting into the medical profession unaware of the possibility of an absolutely astronomical workload and those long hours and very little time for personal care.
Yes, I would tell you, I wanted to be a physician since I was 4 years old. And I wanted to spend my entire life to try to get to the goal where I could go up to take care of anyone in any place in the world and try to do the best I can to save their life, no matter what their medical situation was. And being in the Air Force and being in war zones and being overseas and here in the practice of civilian medicine, I've been able to do that. But the restrictions that were given based on economic credentialing by insurance companies has really restricted that. And I would really love to talk to people about being able to practice medicine the way that they've always desired to, by starting especially in the Signature program and the concierge medical practices.
Now, becoming a member of SignatureMD Concierge Medicine or any other type of concierge medicine system or platform, are you saying that you have to practice concierge exclusively, or are there concessions if you want to continue with patients that you normally deal with in the traditional sense?
Well, the practice of concierge medicine is quite different in different locations with different doctors. SignatureMD allows what's called a hybrid medical practice. In that hybrid medical practice, in my clinic here, it operates in that I see every patient that comes in the door. All my new patients are seen by me. Instead of the typical 7-minute driven insurance visit that we're allowed to take care of our patients, I spend 45 minutes with each person when they come in the door. I usually see them at least once. Most of the time I see them a second time so that I can take care of most of their medical problems, review their records, and issue from that. At that point in time, a lot of times they decide if they're clinically stable, if they want to stay in the Signature program and join the concierge practice, or if they want to stay in the traditional practice of medicine. In the Signature program, again, it's about the equivalent of the price of a latte at Starbucks, about $5 a day or less. The patients will then have an hour-and-a-half appointment to see me to get even further into the patients to develop an entire comprehensive plan where not only do we look at all their medical problems and surgical problems and family history and preventive tests that have been done in the past, but also to use a comprehensive laboratory that is now available through the Signature program, and then look for future risk factors as well as disease processes that they did not know of, to come up with an entire treatment plan for the patients. It's been a wonderful thing where you can actually practice medicine, prevent disease rather than wait until they cross the line for the disease, and really make an impact by educating the patient in depth of why they might want to do the things we ask them to do.
When it comes to referrals, say from the VA, how often do you see those come across your desk?
Well, actually, the VA, they don't usually refer out to primary care. A lot of the patients that have been in the VA system that have difficulty getting into the VA, getting through the phone system, getting appointments to see the providers, getting referrals from the VA, within the VA or outside the VA. A lot of times the patients will actually leave the system and come out and use their Medicare or their other insurances and see us in the civilian world. And then a lot of them do love to join the Signature program in the concierge practice because they're not used to that.
Now, do you think that as the Affordable Health Care Act transitions and grows and transforms over the years, do you think that concierge medicine will be, I guess for lack of a better term, more insurance friendly from the insurance provider's point of view?
Well, the insurance companies, a lot of them, they actually, I think that they would love to have concierge medical doctors, and because the things that we do don't cost the insurance companies anymore. As a matter of fact, it saves them quite a bit. I had 2 insurance companies, which I probably should not name the names, who came to me in the last year, and each asked me to take more of their patients because in each program, I saved each insurance company more than $1 million in the last year.
Wow!
By spending time taking care of people. For instance, I can tell you last week, I had a gentleman that came in. He was a new patient to get established. He came in probably about 4:15 in the afternoon to get settled in. And when I first looked at his blood pressure, it was 190 over 120. And so, most doctors at that point in time with a 3-minute office visit would call 911, have an ambulance come to their clinic, and have the patient whisked off to the hospital and get them taken care of. But instead of doing that, I started talking with him, and he was fine. He felt fine. He has no history of hypertension. And so I sat with him, I talked to him about his blood pressure, and I did his exam, and I went through all his history. I checked his blood pressure over time. It was still there. He didn't have any other signs or symptoms of what's called hypertension crisis. And so I talked with him, and he had just taken a double dose of a nutritional supplement that he uses before he exercises. So I better not say which one it was or which company it was with. Yeah. But in talking with him and seeing this, I was able to give him a medication that we have in our closet. It's called a beta blocker, and I gave it to him, and I stayed with him until his blood pressure came down to acceptable rates, which was probably about an hour and a half, 2 hours later. And then when his blood pressure was acceptable, I checked another EKG, I did another exam on him, and I let him go home with my phone number. I gave him the option, telling him that I could send him to the hospital, send him to the emergency room, what normally would happen to him, or that we could, do it in this way. Of course, he didn't want to spend the deductible, the amount of money going to the emergency room when he felt fine, and he's been taking the supplement, forever. And so I called him that night. He told me that his blood pressure was even better. The next morning, I called him. He said his blood pressure was fine. And so as the day went on, his blood pressure normalized, and he did not need to go stay on that blood pressure medication. So not only did I find him, I saved a lot of the money to the insurance company. I saved him a lot of time in the emergency room. again, in taking care of the patient, I figured out what it was, so you do not have to be taking those supplements any longer. And it really changed his risk factors for heart attacks and strokes and sudden death and aneurysm rupture, to really take care of the patient. And the wonderful thing was he was brand new and he was not even in the Signature program, or neither was any member of his family.
So the effects are far-reaching of simply taking the time to delve a little bit more into a patient's situation and just to simply talk. I mean, the financial benefits alone should be enough to push this thing forward as far as the entire healthcare industry is concerned.
Well, the bad thing is in the practice of medicine now, when a doctor is rushed, then a lot of times they do, I hate to say the word punt, but a punt is either a referral or a test. And so, again, if you don't have time, you don't want to say to your patient, I have to be out of here in 7 minutes or I'll get fired. So they will give them a referral, which is expensive, or they'll send them for a test, which is usually expensive. Mm-hmm. And so, and when they are practicing, 3-minute visits or 7-minute visits, then I hate to say, but it's almost like veterinary medicine. If you can't talk to the patient, it's like being a veterinarian. And it's very, how do you practice as a veterinarian? Is by sending patients for tests and doing procedures, which is a very expensive process in our population. So the Signature program lets us turn patients back into people, and that we see the person as not a problem, but as some of medical risk factors that can be changed and manipulated to help let them live long, healthy, productive lives. Mm-hmm. And it's very cost effective. It's very effective. The patients don't become ping pong balls zipping through the system, never getting anywhere. It's to sit down for 45 minutes or an hour and a half at once and look at the whole patient, and then fix each problem, in a short period of time, and then, come back at the end of it is a wonderful thing to do.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, and we've been talking with Frank Ditz in studio today, returning guest to talk with us about SignatureMD Concierge Medicine. He's a board-certified physician in Florida, specializing in primary care and family medicine, and we've been talking about some of the benefits of practicing concierge medicine, also talking about some of the possibilities of having concierge medicine become more widespread throughout the healthcare industry. It's been great having you here with us today, and thank you so much.
Well, thank you for having me.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.